Hi, I'm Liz. I'm one of the registered dietitians at the Clay County Public Health Center WIC office, and I'm also the WIC breastfeeding coordinator.
Hi, I'm Julia Hladky. I'm the breastfeeding peer counselor over here at Clay County WIC office.
And today we're very excited to be partnering with the Mid-Continent Public Library to bring you our presentation. We will be answering questions in the chat, so if you do have questions, be sure to chat us and we'll be happy to answer. All right, so for our objectives today, our program is called Breastfeeding Basics. The objectives of this presentation are to help you identify 3 benefits to the baby with breastfeeding, identify 3 benefits to the mother with breastfeeding, and list 3 ways to get off to a good start while in the hospital. We also want to make sure you're able to identify 3 infant feeding cues and demonstrate 4 different positions used when breastfeeding. The American Academy of Pediatrics has a breastfeeding policy statement where they recommend infants should be breastfed exclusively for the first 6 months after birth. And what that means is that they're just receiving breast milk and no solid foods. After the first 6 months and until the infant is 1 year old, the American Academy of Pediatrics recommends that the mother continue breastfeeding while gradually introducing solid foods into the infant's diet. After 1 year, breastfeeding can be continued as mutually desired by the mother and her infant. Now I'm going to show you some pictures, and I want you to tell me if you think the left side is breast milk or formula. Okay? And who thinks the right side is breast milk? All right. Now, what we know is that the right side is actually breast milk. Breast milk and formula are not the same. And the thing that you'll notice in the breast milk photo is that breast milk is a living substance. You'll see all the cells. It's full of 200 nutrients in the perfect combination to help babies grow healthy and strong. It's also full of substances that help protect your baby from infections and illnesses. And human breast milk also changes to meet the baby's needs. So as your baby grows, your breast milk will also change. And unlike formula, that doesn't change to meet your baby's needs. It's just one standard formulation. So that's there's lots of differences between breast milk and formula. And now we're going to look at how formula stacks up to breast milk. So if you look at the right side, the higher stack is breast milk. And that shows you all the health benefits that breast milk has over formula. So there's tons of anti-allergens, antivirus, anti-parasite. So all of these protections for your infant. Also hormones, disease-fighting stem cells, and enzymes that help your baby digest the milk better, and also growth factors. Now for infants, there's tons of benefits for breastfed infants. So we know that breastfed babies have less risk of ear infection. In fact, the longer that you breastfeed, the infants have even greater protection from ear infections. They also have protection from respiratory infections like colds and pneumonia, decreased risk of diarrhea, constipation, spit up, also decreased risk of SIDS, obesity, diabetes, decreased risk of asthma, allergies, eczema, and childhood leukemia. So there's lots of reasons and benefits for infants who are breastfed. For breastfeeding mothers, there are also many different benefits for mothers. For short-term health benefits, you tend to have faster recovery from pregnancy after childbirth, faster loss of pregnancy weight. You tend to burn between 400 to 500 calories on average for a fully breastfeeding mom. And you also have long-term health benefits. Lower risk of breast cancer, lower risk of ovarian cancer, lower risk of type 2 diabetes, and tend to have lower blood pressure. Now, when you're preparing to breastfeed, taking a breastfeeding class makes it more likely you'll be successful at breastfeeding. Lots of people don't have information about breastfeeding. So class is a great way to start and get that information so that you feel confident and prepared before delivery. So just by attending this presentation, you're getting that information. Also, it helps to make a birth plan and share it with your doctor and the hospital where you plan to deliver your baby. Make sure that they know you want to breastfeed. Make sure that they have that infant close to you after delivery so that you can breastfeed right after delivery or within the first hour. Also, find out if the place you plan to deliver is a baby-friendly hospital or birth center. They have extra training and can really be helpful to help you meet your breastfeeding goals after delivery. So for the next part of the presentation, Julia is going to speak to you about how to get off to a good start while breastfeeding.
Okay, thank you, Liz. Yeah, so we're going to talk about getting off to a good start. And it starts right there in the hospital, right after delivery. So doing skin to skin right after birth is wonderful. So it has lots of benefits to that. We want to make sure that you breastfeed within the first hour. So the benefits of doing lots of skin to skin is when after birth, baby is placed right here on your abdomen or your chest area, and it's going to have the baby's going to hear your heartbeat, it's going to hear your breathing, it's going to know this is home, and it really states the first emotional state for that baby. It sets that first emotional state. So, and actually, it acts like a warmer because your body knows it just had a baby, so it automatically heats up, okay, to keep that baby warm. So we don't want any barrier between baby and mom neither. So just skin to skin. Rooming in with your baby is very important. Usually some of these hospitals nowadays do not have nurseries. So the baby will stay in your room day and night. So that way you can get to know your baby's signals, which goes to the next one is breastfeeding on demand. So when you see those babies' first cues of hunger by taking their hand up to their mouth, they're moving their tongue in and out, that is really some really good signs that baby is hungry. Then of course we want to do the skin to skin right away and lead them over to the breast area. We really want to practice on no bottles or pacifiers. It is evidence-based if we do not offer the pacifier for 3 to 4 weeks after baby's born. They don't know about it until we give it to them. So just giving them the breast is all they need to know at that time. And we can always introduce it a little bit later. The very first 24 hours are so important though. We want to breastfeed exclusively if we can, unless medically indicated. And there's lactation consultants to help you with that. So ask for help. Don't be afraid. You can always have your partner ask for help if you feel a little, scared to ask or whatever. You want to speak up. Let them know what you want. This is your baby. This is your journey as breastfeeding goes along. And we talked about those early hunger cues. So, that's why we want to keep that baby in our room with us so we get to know them. So baby's going to be stirring around a little bit. They're going to be opening their mouth. They're going to be turning their head. Those are early cues. And when we, sometimes there's mid cues, hunger cues. So they're stretching around, they're increasing their movement, they're taking their hand to their mouth. That's a real good signal. That's actually sign language right there that baby's hungry. And they do it automatically, which is so cool. Late cues, they're crying, they're aggravated, they're turning red. So this is a time to do lots of skin to skin with baby. Just bring baby up to the chest area, calm them down, talk to them in a nice calm voice. And, rub their body a little bit, stroke them a little bit, and then, calm them down, then take them down to the breast to get that good latch going. So babies can feel when you are a little anxious or something like that too, then baby will be anxious. So the calmer you are, the better baby's going to be calm and a better breastfeeding outcome. And that very first milk that we get is called the colostrum. And some moms leak before they actually have baby, which is a good sign. So that first milk is actually called colostrum. And it's called liquid gold. It's full of antibodies and white blood cells. Very healthy for that baby. It's like giving them a super shot of nutrients right away. Your milk will transition that day 2 to day 5, days after delivery. So just be aware that you might see your breast getting a little bit bigger. You're changing the volume, so it's making more milk, and composition is always changing. And your mature milk comes in by day 14, around that area. So our milk is made of 87% water. And that's all the nutrition needed for the very first 6 months of life for baby. So no additional water is needed, no plain water. You have enough water in your milk, in your breast milk. So how big is a newborn stomach? It's a very good question, because day 1, believe it or not, that stomach is just the size of a cherry. It's very small. So just realize that your milk is coming in very small amounts. Baby is taken in very small amounts, but more often throughout the day. That's normal, okay? Day 2, the stomach of that baby will go to a size like a walnut. And then that's when your milk is really starting to come in, day 2, day 3, somewhere in that area. And it can be up to an ounce, okay, on both sides. 1 week is the size of an apricot. So yes, that baby is growing very fast. 1 month, boy, you're making about 3 to 5 ounces there. So baby is growing very fast that very first 2 weeks and into the first month. And that's when we really are able to build up our milk supply. That very first month is very important to keep baby up to breast at all feedings if possible. And here's another great question moms ask me all the time. Is my baby getting enough milk? We want to look at a few things. So how do you know if your baby's getting enough milk? Well, we want to make sure that we're breastfeeding 8 to 12 times in a 24-hour period. We want to make sure that baby is gaining weight, and you're going to be taking your baby to the doctors. And if you're on the WIC program, we're going to weigh baby especially. Breast may feel softer after feeding, so that's also a good sign that your milk is transferring over to baby, okay? And you can hear or see that your baby is swallowing, and you're always going to count the diapers. Remember to count the diapers. It is very important, and it makes you feel more confident as a mom, breastfeeding mom, that your baby's getting enough. That day 1, we are having some stools and some wet diapers. But just remember, your breast milk is coming in smaller amounts. So that first day, we may just have a wet diaper and a dirty diaper, okay? You might see that as black and sticky. That is normal. Baby's just cleaning out their intestinal tract. And by day 2, you may have 2 wet ones and 2 dirty diapers. That's great. You're on track. Day 3, 3 wet ones and 3 dirty ones. So again, you're on track, and it may look a little greener at that time, and that's fine too. That's normal. Day 4, you're going to have like 4 wet ones and maybe 3 dirty ones. It just kind of depends. But we always want to make sure that you're having a nice wet solid diaper to count it, and a stool that is bigger than a quarter to count. So you're on the right track when you see that. By day 5, your milk on that dirty diaper is going to look a little funny. It's going to look kind of yellowish and maybe a cottage cheese looking like thing. It's not diarrhea. It's just your breast milk being processed. So that is a very good sign that everything's working good. Babies do go through growth spurts though, okay? So be aware. Sometimes the normal growth spurts in the first year is 2 to 3 weeks, 6 to 8 weeks, at 3 months, 6 months, especially that second, third day too. Sometimes babies are cluster feeding, and what that means is babies just showing more signs of hunger more often throughout the day, and they're just wanting some more milk because they're growing very fast. And when they go through these growth spurts, same thing kind of happens. So they're just wanting more food more often throughout the day, and eating nonstop, getting up for more frequent feedings at nighttime. Sometimes they can be a little crankier, but that's okay. That's them just growing fast. And are they getting enough milk? So we always want to remember that we're breastfeeding, 8 to 12 times. The weight is very important. We're going to see that weight gain, and the number of diapers. So I know there's apps out there to keep track of all that. If you want to, you can do it by paper and pen. That's fine too. Okay, now we're going to talk about the breastfeeding positions. So let's practice. Okay, hi, I'm Julia again, and I wanted to go over the breastfeeding positions. So there's several of them, so they can be a little complicated if you're not doing them correctly, and then baby doesn't get a good latch. So we want to just practice with those positions today. The first one that I'm going to talk about is the cradle hold. So basically, you have baby's head in the crook of your arm here, the elbow, and we're just going to make sure that baby is stomach to stomach with you, okay? And sometimes their little arms may get in the way, but that way you have their head in there in the crook of the elbow, and your arm is holding their rumpus, and you can either adjust your breast by the other arm then, or after you get them latched in a good position, then you can also come back here and hold their legs like this so they are not kicking around so much and they feel more secure. The other one is a cross cradle hold. So all I'm going to do is just move my arms over here. You always want to put your thumb and your fingers behind the baby's ears. You don't really want to hold the baby's head. We want to make sure baby can move its head back and forth to get a good latch. And then with this arm here, you can also adjust your breast if necessary. And then you can just have that hand free for massaging the breast as you're breastfeeding, or just making sure that baby's good. And just kind of lean back and relax when you can, so the milk can flow better and you can be more relaxed too. That's the most important thing. We want moms to be comfortable as well as baby, okay? The next one is just going to be the football hold, and you'll probably practice this a lot in the hospital. So babies are normally just like a football that you're carrying. You can don't really need the pillow at that time. Just use your arm. Baby's so little at that time. Again, you're going to put that hand, your thumb and your forefingers, on the behind their ears, not on top of their head like this, because baby can't move his head if they're feeling that they're being forced to take the breast. So let them have some freedom of their head that goes back and forth like this, and they can hold their neck, but you're also there to help support their neck and their spinal cord and their shoulder blades with your arm and your wrist area, okay? And that's a good one. The other one is called a laid back position. So really you don't need a pillow. You're just gonna let your whole body be the pillow for this one. But we're just gonna lean back in a chair or a comfortable position in the bed or whatever, and you can prop yourself up with pillows on the back. Again, make sure that you're comfortable, Mom. And then get that baby to use your body as a pillow. Normally babies put themselves on a 45-degree angle and they are basically on top of the breast like this, but it helps if you have a really fast letdown. It helps with that to slow down a little bit, and baby has more control of taking that breast milk in when needed. So that is the laid back one. Now I'm going to show you a side laying one, which a lot of moms like too, and Liz is going to be helping me here with that. And basically all we're going to do is just kind of lay on your side, okay? You can put your arm like this, and Liz is putting a blanket behind me to support my back area so I can be more comfortable, and my head as well, so I'm comfortable. We can always bring baby in, and you can have your support person to help you, usually on the bottom breast, and have baby like this. Always stomach to stomach with mom, okay? Because that's really going to help them be more relaxed. They're comfortable in the bed, but you're also there to make sure that they're not suffocating or anything like that. That's very important to keep track of baby, but this is a very nice position too. A lot of moms find that easier than the other ones for them and baby.
Thank you so much for joining our presentation. In conclusion, we want to let you know that having a new baby is exciting. So we're excited for all of you. If you're watching this and you're expecting, or if you just had a baby and you wanted some more information, congratulations. Make sure to get plenty of rest. Also know who to call.
Yes, that's very important. So before you leave the hospital, lots of times they will hold support groups there. So get the name and location of their lactation consultant and where they hold a support group, or the resources, because they will have a list of resources where to go. You can always ask your breastfeeding peer counselor, so that's always a good thing if you're on WIC. And go attend your breastfeeding support group. That's always very informational, either online or in person is good too. So if you would like to have more information about WIC, here we put up our websites and a phone number. Here's the Clay County Public Health Center WIC office. You can contact by email, or their phone number, of course, is 816-595-4358. And WIC, we provide breastfeeding support. And we provide nutrition education, supplemental nutritious foods, health care referrals, and supports, and to be eligible for pregnant women, breastfeeding and postpartum women, infants, and children up to the age of 5. So thank you very much for attending today.
Thank you.
Bye.